Hi, this is MediCircle and I'm your host, Smita Kumar. As you know that we are talking to the top CEOs to watch out for in the year 2020 in our top CEO series. In this initiative, today we are going to speak to Dr. Chytra Anand. She is the CEO of Cosmoderma Clinics, a world-renowned, multi-award-winning cosmetic dermatologist. She's a serial entrepreneur, a working mom, and an innovator. She has been voted India's most respected cosmetic dermatologist in the year 2013. Elle Magazine top 6 skin doctors in India 2015 and has been awarded Rising Star at the World Congress of Dermatology. Not there to stop, she has also been awarded as the Woman Entrepreneur in the Healthcare by Vicky Flo in the year 2019. She has started SkinQ, a new skincare for Indian skin and skin of color. Hi, Dr. Chytra. Welcome to MediCircle.
Hi, Smita. Thank you for having me today.
My pleasure. So, to begin with, Dr. Chytra, please tell us as you know, there are three major challenges of the healthcare industry. One is affordability, then availability, and the third one being accessibility. So, what, according to you, is the solution to eradicate these issues?
I actually think that education would be the best way to eradicate all of these. The reason is that we have to uplift the entire society, honestly speaking. Right now, if we look at the number of people who actually pay taxes in India, it is abnormally low. Literally, only 5% of India supports the rest of 95% of India. And I understand there are a lot of skill programs that have been there. There's Pradhan Mantri Yojana schemes, etc. But until we get the people educated and working, they're not going to make enough money. If they don't make enough money, they're not going to be able to afford things. So it doesn't matter what we do. If there's no affordability, the other two is not at all important. So I really think we need to work on that first, where we make education compulsory for everybody, at least till grade 12, and uplift our government schools, uplift education. Once we do that, what happens with that? We're not just uplifting them in terms of education or giving them a skill program, but we're also giving them a lot of knowledge, which brings about an awareness, which will also help healthcare eventually, because then you have a set of patients that as healthcare practitioners are going to be treating who are more understanding, who are more aware, where it's easier to explain fundamentals to them. So that comes down to your affordability. Now, accessibility, I think accessibility is a tough question. The reason is if we look, 90% of the healthcare is really centered around urban India, with penetration today into tier 1, tier 2 cities. But beyond that, if we look at rural India, where 60% of the Indian population lives today, the penetration is really poor. And this is because the healthcare facilities there, the infrastructure is so poor in the first place. We can say, oh, there's not enough doctors, etc. Sure, there may not be enough doctors or nursing or paramedical care, but if there is no infrastructure and you have doctors, where are they going to go? Where is your paramedical staff going to go if you don't have? So primary healthcare centers, Anganwadis. This is where I think the government of India needs to concentrate. And also public-private partnerships. There are fantastic hospital chains out there today, and doctors who have really become entrepreneurial and made big healthcare changes, like Dr. Naresh Trehan, Dr. Devi Shetty, Dr. Reddy from Apollo, all of these guys. And they're also looking at social impact of what their businesses can do, the carbon footprint, so to speak. And if even if the government really accepts doing a public-private partnership where these hospitals can provide rural care subsidized, that would be a fantastic way to get the accessibility out. Instead of which, a government, instead of thinking of the broader area, they're like going down like a horse with blinkers, sadly. And this is not just this government. It's always been there like for the last 20 years. No one has concentrated on healthcare really. And they're like just looking at the straight path. We don't have doctors, let's put more doctors. We don't have enough nurses, let's improve the nursing schools, as in put more nursing schools. But where are the teachers to teach in medical schools? Where are the nurses? And where are the patients or the infrastructure for these to get practical hands-on? I mean, I was in the Rajiv Gandhi Health University in the syndicate for 3 years. And I saw when we used to go for inspections that some of the medical schools didn't have full-time teachers, and we had to suspend their licenses temporarily because they would all, during the inspection time, they would just get doctors there to act like they were teachers. But the rest of the time, the students didn't even know how to put an IV line, and they would pass out of medical school. Now, that's not really a doctor you want working on you at the end of the day. You don't want a nurse who's never taken somebody's temperature properly or done a like an injection to come and give you injections from nursing care. So I think it's a huge, broad issue, but everything really boils down to few things. One, education of the masses. Second, increased GDP spending, right? Yes, we can say, oh, let's increase our GDP spending, but we're a shrinking economy this year because of COVID. There's only that much that the government can really spend. So we really need to get people paying taxes and taking responsibility and social responsibility. With that, if they're honest about taxes, we can definitely improve infrastructure. So this is what I would say, Smita.
As you just talked about GDP, I'm just adding one question there. Like India's total healthcare spending is at 3.6% of the total GDP, which is very less compared to the other developed countries like US spends around 18%, Japan around 10%. So we are spending less as compared to other countries. Even Bangladesh spends more than us. So do you think it's high time India needs a generous amount of spending in the healthcare sector?
Spending is a good idea, but where's the money going to come from? I mean, really, we can say, okay, let's proportion so much of our GDP towards healthcare. The standard GDP, you should be spending on an average at least 5 to 6% for a country like ours. And you said developed countries, but even developing or underdeveloped countries are spending way more than we are on healthcare. It is a very neglected sector. But we have so much spending to do as such. Like even our road infrastructures are still not ready. Just now, with Swachh Bharat, we've been able to get toilets into rural India. For the longest time, it was open defecation. And I think putting that GDP there, whereas putting it in healthcare, overtakes, right? And it's like a weighing scale, and you've got to balance them out. Same thing. If you have so much GDP, are you going to put it towards education? Then, of course, you always see all of this loan waivers. Where is the loan waivers coming from? They're coming from shrinking of our GDP. So if you proportion, let's say 5% of India's GDP towards healthcare, and then you've given a loan waiver of thousands of crores, where's the money left to spend anywhere else?
Yes.
And then even defense spending is less in India, not just healthcare. So I think sadly, we can always say spend more, but unless we make more, where are we going to spend from? So here is where I always am in support of getting, like, we have CSR activities, right? Corporate social responsibilities. As an entrepreneur yourself, you know that. So I think as a part of a CSR, maybe get like healthcare companies with a certain turnover to spend a part of their CSR or the entire CSR in rural healthcare development, in rural healthcare setup, and then use that fund directly there and give some tax rebates. So that way you have direct at source, workings there, because the government's not going to be able to manage it at the end of the day. They're not even doing a good job with government schools right now. Nobody wants to send their kids to government schools, sadly. And so why would anybody want to go to a government hospital? Only because they can't afford any other health care. So I think this is what we need to look at.
Sure. So Dr. Chytra, how has your journey in the healthcare industry been? Of course, you have got so many awards and your work has been praised throughout your entrepreneurial journey, but there might be some ups and downs. So tell us about them.
I've been very fortunate, but I always believe that if you work really hard, if you're working towards a goal and you have honest intentions, good things will happen. That's my mantra, really. And I do believe in karma. So I think it's important to look at it this way. But I always tell everybody that, success is not instantaneous. It takes time. So and today youngsters have, when I mentor a lot of female entrepreneurs and stuff in this space, I see everybody who has like, in 1 year I'm going to hit this, in 2 years I'm going to hit that, 3 years I'm going to hit that. And you're like, okay, to hit that, what are the goals? So, I always say start with an idea, a goal of where you want to go, and then work backwards and get a plan in action and work towards it. It's very easy to get distracted, especially for female entrepreneurs, because in our life cycle, we're so many things. You're a daughter, you're a daughter-in-law, then you're a wife, you're a mom, and then you become like a mother-in-law. There's so many things happening in our life cycle. And especially when you have the whole responsibility as a mother, it can be very distracting to a full-time working professional. And so we have to get really smarter with the way we work, and we have to be really focused. And there's no time to waste, because whatever extra time you have, you want to spend with your kids. So I think stuff like that, like you yourself were saying that you have a kid and how things change. So I think this is what I always tell people, that, work hard towards your goal. You'll achieve it. Maybe not in 2 years, if possible, but you will get there. But stay the course. It's so easy to give up, and it's so easy to look at small problems and think that, why me? Why only me? And I think one must get out of it and understand that, you're not a fish in a pond, but you're a fish in an ocean. Everybody has their struggles, and you just have to go with it, be strong, be brave, and fight through all of it. I've had my ups and downs, and even as recent as COVID, I had to think, like, do we keep all our clinics open, or do we actually shut some of the clinics down? Do we stagger the staff? How do we ask people to take a pay cut? These are all real-time problems. And of course, people didn't want to take pay cuts, and you have to talk to them about how it's important in this COVID scenario, because none of us knew how to predict. I mean, nobody predicted that your 2020 balance sheet, 2021 balance sheet is going to look like this with a COVID hat.
Yeah.
But we all have to gear up and, get back to work. Yeah. So that's how it is. And, I think some of the problems that I think can be out is system problems. Something as small as getting like a trade license, as a health inspector coming and inspecting your facility. These are you should not really be having issues with. A lot of it has become online now, that I've seen in the last 14 years in my journey as an entrepreneur. But the smallest things are the toughest things in India. The big things are actually easy. It's the small nitty gritty things. And for unnecessary reasons, they make it so complex. So I think it needs a system revamp. And also, like something like telemedicine, right? Till COVID hit us, telemedicine was actually illegal in India. Think about it. In 2020 February, the courts would not accept telemedicine, and you could be having a medical legal consequence. And because of COVID, the government suddenly brought it about. And I'm like, if you had brought it out in 2015, 2016, telemedicine is the way that rural India can get medical care, because all they need is their phone. And today, the penetration of Flipkart and Amazon in India will tell you that, rural India is one of the highest spending on e-marketplaces. And that will tell you that with that, what happens is that everybody has access to phone. In fact, every Indian has literally 2 cell phones, according to the telecom data. And data is so cheap today. And so, open up faster. I think the last big revolution was when PV Narasimha Rao opened up the telecommunications to India and let it in, which was in 90s or 80s. And since then, where's the revolution?
Definitely. So, Dr. Chytra, one quick question on COVID. Like, we have seen a lot of changes in the healthcare industry works due to COVID. Like, COVID has made everybody health conscious. And the perspective to healthcare, just as you said, digital online consultations are happening, which were always there. But yes, it all started in after March 2020. So what, according to you, will be the future of healthcare?
I think the future of healthcare mainly rests with online, artificial intelligence, and robotics. That's where I think our future is going to go. I mean, there's already IBM Watson. It's this big supercomputer where they've done this whole dermatological program where it gets, you feed in the data as to your symptoms, and the computer will give you a diagnosis and a prescription. And it's 98% accurate. You know, that is an amazing feat. And then in radiology, also, you already have AI coming into it, where they've fed the CT scan reports, MRI reports, and AI can actually read and decipher their scan reports. And it's about 96.8% accurate, 2% more accurate than humans. And so I think our future is going to be faster, quicker, easily accessible. And today, right, people are also thinking that, yeah, I don't have to go see my doctor. I don't need my doctor to check my pulse, my BP, and everything, right? You've got all the home thermometer, home oxypulse meters. Everybody has everything now. Yeah, all you can do is take it yourself, and then you can get online and consult your doctor.
Definitely.
And they're open to the fact that even if I'm not physically in the same room, the doctor can actually make a diagnosis. They can give me a prescription and it'll work. Till before that, I remember at Cosmoderma Clinics, we were trying to get our patients to review with us post-procedure online. So we would say that in 2 weeks after procedure, we want you to review with us online. They're like, no, I don't want to do online. You know, I will come in physically. And we're like, but it's only a 5-minute check. You can do it online. They didn't want to. And now we have new consults that happen online all the time. And once the consult's done and the patient's comfortable, they'll come to the clinic. So the change is already here, and most people have adapted. And this COVID, yes, it's been a bit of a disaster and an epidemic to the world, but in a way, a small blessing to mankind, because it has given people a chance to retrospect, to reflect, and to adapt. And you know, humans are such adaptive creatures, but they're so resistant at first. Change, everybody seems to resist change till the whole mass movement happens. And I think this was a mass movement of adaptation and change. And you know, there's WhatsApp calls, there's Zoom calls, and people are now using all the technology possible to get work done. And so I think the future is already here, and we're gonna play catch up.
Surely. So thank you so much, Dr. Chytra, for coming to MediCircle and sharing your insightful views with us. I think what you said, that we need to be hardworking to reach our goals, and you have to be focused, you have to be resilient, and just be patient. And things would really, really be in your favor sometime.
Yeah. And if you have honest intentions and you're not distracted, you'll get there. It's not elusive. You just have to work at it. Don't give up.
Definitely. So that's the good inspirational words from Dr. Chytra Anand there. So once again, thanks, Chytra, for joining us at MediCircle here.
Thank you so much for having me. Pleasure. Take care, stay safe, stay healthy, and stay beautiful.
Same way. Thanks. Bye-bye.